Hello and welcome to this channel. In this video, we will talk about kidney failure and dialysis. Renal failure, also known as kidney failure, is a critical condition characterized by the loss of kidney function, leading to the accumulation of waste products and imbalances in fluid and electrolyte levels. In this video, we will talk about causes of renal failure, its classification, diagnosis, symptoms, and treatment options, including hemodialysis and peritoneal dialysis. How can we classify renal failure? Renal failure is characterized into two main groups, which are acute renal failure and chronic renal failure. Acute renal failure is characterized by a sudden and rapid decline in kidney function, typically occurring over a period of hours to days. It is often reversible if the underlying cause is identified and treated promptly. Acute renal failure can be further classified into three categories, which are pre-renal acute renal failure, intrinsic acute renal failure, and post-renal acute renal failure. Pre-renal acute renal failure occurs when there is a decrease in blood flow to the kidneys, leading to inadequate perfusion. Common causes include dehydration, which can be due to reduced fluid intake, excessive fluid loss, for example by vomiting or diarrhea, or severe burns can lead to decreased blood volume and subsequently reduced renal perfusion. Another cause is hypovolemia. Conditions like severe bleeding, fluid loss due to burns, or fluid redistribution, as seen in sepsis or anaphylaxis, can cause a decrease in blood volume, leading to pre-renal acute renal failure. Also, a decreased cardiac output can lead to acute renal failure. Heart failure, myocardial infarction, arrhythmias, or any condition that impairs cardiac function can result in inadequate blood flow reaching the kidneys. Another cause is renal artery stenosis. This is a narrowing of the renal arteries due to atherosclerosis or other vascular diseases and can restrict blood flow to the kidneys. Another cause is hypotension. Severe hypotension caused by shock, sepsis, or anaphylaxis can reduce renal perfusion. Intrinsic acute renal failure refers to kidney damage caused by problems within the kidney themselves. It can result from conditions such as acute tubular necrosis. Acute tubular necrosis is one of the most common causes of intrinsic renal failure. It occurs due to ischemia, so lack of blood flow or toxic injury to the renal tubules, often caused by severe hypotension, sepsis, nephrotoxic medications, or contrast agents used in imaging procedures. Another cause is acute glomerulonephritis. Glomerulonephritis is inflammation of the glomeruli, which are the filtering units of the kidneys. It can occur as a result of various immune-mediated conditions, infections, or autoimmune disorders, leading to impaired kidney function. Also, acute interstitial nephritis can lead to renal failure. Interstitial nephritis involves inflammation of the renal interstitium, so the tissue surrounding the tubules and blood vessels. It can be caused by medications such as certain antibiotics, non-steroidal anti-inflammatory drugs, infections, or autoimmune diseases resulting in renal dysfunction. And lastly, post-renal acute renal failure. Post-renal acute renal failure occurs due to an obstruction after the kidneys, typically in the urinary tract, which prevents urine from being eliminated from the body. Causes of post-renal acute renal failure include urinary tract stones, as kidney stones or stones in the ureter, and they can block the flow of urine, causing a backup of urine into the kidneys. Also, benign prostatic hyperplasia can lead to renal failure. An enlargement of the prostate gland in males can obstruct the urethra, impeding the flow of urine. Alternatively, urinary tract tumors, so tumors in the urinary tract, such as the bladder or urethral cancers, can cause obstruction and subsequent renal failure. Tumors or masses in the pelvic area can compress or obstruct the urinary tract, leading to post-renal acute renal failure. Another cause is neurogenic bladder, which is a condition characterized by nerve damage or conditions that affect the nerves controlling bladder function and can result in urinary retention and potential obstruction. The other main type of renal failure is chronic renal failure. Chronic renal failure is a progressive and irreversible decline in kidney function over a period of months or years. It is typically characterized by gradual loss of nephrons, which are the functional units of the kidneys. Chronic renal failure is commonly caused by conditions such as chronic kidney disease, diabetes, hypertension, polycystic kidney disease, or autoimmune disorders affecting the kidneys. Chronic renal failure is further classified into 5 stages, based on the estimated glomerular filtration rate, which indicates the level of kidney function. In stage 1, there's kidney damage with normal or mildly reduced estimated glomerular filtration rate. Typically, in this stage, the glomerular filtration rate is over 90 ml per minute. In stage 2, there is a mild to moderate reduce of the glomerular filtration rate. In this stage, the glomerular filtration rate is typically between 60 and 89 ml per minute. In stage 3, there is a moderate to severe reduction of the glomerular filtration rate, with a glomerular filtration rate of 30 to 59 ml per minute. In stage 4, there is a severely reduced glomerular filtration rate, with around 15 to 29 ml per minute. And stage 5 describes end-stage renal disease with kidney failure. In this stage, the GFR is usually below 15 ml per minute, and there is usually a need for renal replacement therapy, such as dialysis or kidney transplantation. As chronic renal failure progresses and goes through the stages, the kidneys lose their ability to function adequately, leading to a buildup of waste products, electrolyte imbalances, fluid retention, and other complications. The severity and progression of chronic renal failure are usually classified into the different stages based on the glomerular filtration rate, which reflects the level of kidney function. How can we diagnose renal failure? As usually, our first step in the diagnosis is a thorough medical history and physical examination. We want to evaluate symptoms such as fatigue, decreased urinary output, and edema, and possibly identify risk factors and underlying medical conditions which can indicate renal failure. We can also do a number of laboratory tests. Those include the following blood tests. First, serum creatinine. Creatinine is a waste product generated by muscle metabolism and is filtered by the kidneys. An elevated serum creatinine level indicates a reduced kidney function. Serial measurements of creatinine are used to monitor the progression of kidney disease. Blood urea nitrogen, commonly abbreviated as BUN, is a waste product derived from protein metabolism. Elevated blood urea nitrogen levels can indicate impaired kidney function, but it can also be influenced by other factors. The blood urea nitrogen to creatinine ratio can provide additional information about the cause of kidney dysfunction. The estimated glomerular filtration rate is, as we talked about, typically used to classify chronic renal failure. The estimated glomerular filtration rate is a calculated value based on serum creatinine levels, age, gender, and race. It provides an estimate of kidney function and is used to stage chronic kidney disease. Blood tests also measure electrolyte levels such as sodium, potassium, bicarbonate, and chloride. Imbalances in these electrolytes can occur in kidney failure. We can also assess the kidney function by urinary tests, such as the urinalysis. A urinalysis evaluates the physical and chemical properties of urine. It assesses parameters like protein, blood cells, glucose, specific gravity, pH, and the presence of bacteria or crystals. Abnormal findings can indicate kidney damage or other urinary tract disorders. We can also measure the urine protein to creatinine ratio. This test measures the amount of protein in the urine in relation to creatinine. Elevated levels of protein in the urine, called proteinuria, can indicate kidney damage. Other more invasive tests are kidney imaging and kidney biopsy. Imaging studies such as ultrasound, CT scan, or MRI may be performed to assess the size, structure, and abnormalities of the kidneys and urinary tract. In certain cases, a kidney biopsy may be recommended to obtain a sample of kidney tissue for microscopic examination. It helps to determine the underlying cause of kidney disease and guide treatment decisions. How can we treat renal failure? The first step in the treatment of renal failure is conservative management. Conservative management refers to non-invasive or non-surgical approaches used in the management of renal failure, particularly in the earlier stages. The primary goal of conservative management is to slow down the progression of kidney disease, to manage symptoms, and improve the patient's quality of life. Some common strategies involve: first, medications. Medications may be prescribed to control underlying conditions contributing to kidney damage and to manage symptoms. These may include medications to control blood pressure, such as angiotensin-converting enzyme inhibitors or angiotensin receptor blockers, medications to manage diabetes, to control proteinuria, and to treat specific complications associated with renal failure. Another conservative treatment approach is dietary modifications. This may include restricting certain nutrients like sodium, phosphorus, and potassium, and ensuring adequate intake of high-quality protein. Dietary modifications can help to control blood pressure, manage fluid balance, and reduce the workload on the kidneys. Also, proper fluid management is essential in renal failure. Patients may be advised to monitor their fluid intake and limit it based on their individual needs to prevent fluid overload and edema. This includes regulating the intake of water, other beverages, and foods with high water content. Important is also that patients with renal failure require regular monitoring of kidney function through blood tests to assess markers like creatinine, electrolyte levels, and estimated glomerular filtration rate. Close monitoring allows us to adjust treatment plans, assess disease progression, and manage complications promptly. Another treatment option is renal replacement therapy. This refers to the medical interventions used to replace the essential functions of the kidneys when they are no longer able to perform adequately. Renal replacement therapy is necessary for individuals with end-stage renal disease or severe kidney failure to sustain life and manage the complications associated with kidney dysfunction. Dialysis is a medical procedure that helps filter and purify the blood for individuals with impaired kidney function. It is typically used in cases of chronic kidney disease or acute kidney injury, where the kidneys are unable to perform their normal functions of removing waste products and excess fluid from the body. There are two main types of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis involves using a machine, called a dialyzer, or artificial kidney, to filter the blood outside the body. The patient's blood is pumped through a dialyzer, which removes waste products and excess fluid and then returns the clean blood to the body. There are some advantages and limitations to hemodialysis. One advantage is that hemodialysis is usually performed in a specialized dialysis center, which allows for close monitoring by healthcare professionals. It is an effective and efficient method of removing waste products and excess fluid from the body. One of the limitations of hemodialysis is that it typically requires multiple sessions per week, with each session lasting several hours. This can be time-consuming and restricts the patient's mobility. Additionally, hemodialysis requires vascular access, usually in the form of an arteriovenous fistula or a catheter, which may have associated complications as infections. Peritoneal dialysis involves using the peritoneal membrane in the abdominal cavity as a natural filter. A sterile dialysis solution is infused into the abdomen through a catheter, and waste products and excess fluid pass from the blood vessels into the dialysis solution. After a certain dwell time, the solution is drained out and fresh solution is infused. One of the advantages of peritoneal dialysis is that it can be performed at home, offering more flexibility and independence for the patient. It does not require a machine, and the dialysis process can be done while the patient goes about their daily activities. One of the limitations of peritoneal dialysis is that it requires regular exchanges of dialysis fluid throughout the day. It may not be suitable for individuals with certain abdominal conditions or infections. There is also the risk of infection associated with the catheter used for infusion and drainage. The choice between hemodialysis and peritoneal dialysis depends on various factors, such as the patient's overall health, lifestyle, preference, and medical considerations. Both types of dialysis aim to achieve similar outcomes in terms of removing waste products and excess fluid from the body. Dialysis is a life-sustaining treatment for individuals with end-stage kidney disease or acute kidney failure. It helps to manage symptoms, improves the quality of life, and prolongs survival. However, it is important to note that dialysis is not a cure for kidney disease and requires ongoing treatment and monitoring. In some cases, kidney transplantation may be considered as a long-term solution for eligible patients. Renal transplantation is a surgical procedure in which a healthy kidney from a donor is transplanted into a recipient with chronic kidney failure or end-stage renal disease. It is considered a treatment of choice for many patients with chronic kidney failure, as it offers the potential for a better quality of life and improved long-term outcomes compared to long-term dialysis. What are complications of renal failure? Renal failure, especially in its advanced stages, can lead to various complications affecting multiple organ systems. In the last part of the video, we will go through the complications of chronic renal failure organized by the organ systems they affect. First, the cardiovascular complications. Kidney failure can disrupt the regulation of blood pressure, leading to hypertension, which further contributes to kidney damage and increases the risk of heart disease and stroke. Impaired fluid balance can result in fluid retention, leading to edema and congestive heart failure. Second, electrolyte and acid-base imbalances. The kidneys regulate potassium levels in the body, and their dysfunction can lead to elevated potassium levels, which can be life-threatening and cause cardiac arrhythmias. Kidney failure can also disrupt the balance of sodium in the body, leading to either low or high sodium levels, affecting the body's fluid balance and nerve function. Decreased kidney function also impairs the elimination of acid from the blood, resulting in an accumulation of acid and a decrease in blood pH. Anemia. The kidneys play a vital role in the production of erythropoietin, a hormone that stimulates the production of red blood cells. In renal failure, erythropoietin production decreases, leading to anemia, which can cause fatigue, weakness, and other symptoms. Bone and mineral disorders. Chronic kidney failure can disrupt the balance of calcium, phosphorus, and vitamin D, leading to bone diseases such as renal osteodystrophy. This can result in bone pain, fractures, and abnormalities in bone mineral density. Gastrointestinal complications. Nausea, vomiting, and loss of appetite are common symptoms in renal failure. Accumulation of waste products and alterations in gastrointestinal function contribute to these complications. Neurological complications. Uremic encephalopathy is one of the possible neurological complications. The build-up of waste products in the blood can affect brain function, leading to confusion, cognitive impairment, seizures, and coma. Also, nerve damage can occur in renal failure, resulting in peripheral neuropathy, which is characterized by symptoms like numbness, tingling, and weakness in the extremities. Impaired immune function in the presence of dialysis catheters or weakened immune response in advanced renal failure can also increase the risk of infections such as peritonitis in peritoneal dialysis or bloodstream infections. That's it for this video. I hope it was helpful, and if you like our channel, please subscribe. Thank you for watching, and hopefully see you again in the next video.